Good day everyone, I'm Giselle Daniel from NU204 and today I'm going to perform the physical assessment of the breast, the lungs and the thorax, the heart and the neck vessels and also the abdomen. So first is I'm going to introduce myself to the client and also I'm going to explain the procedure to him. Good day sir, I'm Giselle, a student nurse from Asian College of Technology. Um, may I know your name?
It's January,
And when is your birthday?
November 30, 2001.
Can I see your wristband, sir? Okay. It's much from the record. So now let's provide the privacy to the client. So I'm going to close all the curtains and also I'm going to do a hand hygiene. And also I will be telling the client that the procedure will be confidential and also he don't need to worry and I'll be asking a consent that I will be inspecting, palpating, percussing, and ausculting while doing the procedure. So, sir, can you remove your gown? So, in doing the I will be starting in the physical assessment of his breast. So I'll be inspecting if there is any unusual or abnormalities in his breast, any discoloration of his skin, any swelling or any redness, or I'm going to ask him if he noticed any changes. Sir, nara kayo mga changes na pan sa imong breast? Wala. So as we can see, there are some scars on his breast, on his chest part, the upper breast, and the color of his areola and his nipple. The nipple is much darker than the areola, and also his areola. There are some hairy thing, and there's, and then it is everted. It is not inverted. It is not flat, and uh, symmetry. It is equally with the chest wall. And when examining the and inspecting the breast of the female, it's different. It's sometimes they are rounded, and also examining the breast of the female and the obese male are the same. And then after inspecting the breast, I'm going to palpate. So I'm going to use gloves for the client to be um, less anxious when I palpate it. So this is for also for protection. And then I will be palpating his below his axilla, the lymphatic nodes, if there is any swelling of his lymph nodes. Okay, so down here, the 3 fingers, and then here, and then the other side, and then so there is no swelling. And also I will let the client lie down in a supine position for breast examination and palpating if there is masses, lumps, or um, tenderness in his breast. So higalag kamay, sir. So in doing the palpating in a circular motion, and then pinch the nipple if there is any discharges, and if there is discharges, it must be go for a a biopsy or a further examination. And also discuss the client that there is a self breast examination, and also there is a screening for a breast cancer like the digital mammograph or the MRI. So after palpating the client's breast, I'll be proceed to the heart of the clients and the neck vessels. So in doing the physical assessment of the heart, I'll just give a quick overview of the physical anatomy and physiology of the heart. The heart consists of the right atrium, the left atrium, the left ventricle, and the right ventricle. So there is also the aorta, and the the major rule of the heart rule is to pump blood. And I will be also inspecting for edema, and then after inspecting for edema, I will be proceed to ausculting the client's heart. But the position of the client's heart is in a supine position and in a 30 to 45 degree angle, and it is in a Fowler's position, and then it is slightly elevated. And I'll be ausculting. This is the stethoscope. This is the diaphragm. Unfortunately, I don't have the bell, so when ausculting, the diaphragm will be used into high pitch sound, and the bell will be used into the low pitch sound. So since I don't have it, so let's just assume that I have the bell. And also in ausculting, I make sure that the environment is it is not noisy, and also it is much better that the client is in a bare skin and he is not wearing clothes, because it can mimic the sounds. And if the client has a hairy chest, then maybe put slightly wet the hair, so there's nothing that can alter in examining the heart sounds of the client. So we'll be ausculting it from the in a zigzag pattern, starting at the base of the heart and working downward to toward the apex. So there is easier for to remember the five areas for listening to the heart. They the they call it the all people enjoy Time magazine. So the EPT, all people enjoy ET Time and magazine. The five areas for listening the heart is the aortic valve, and the pulmonic valve, and the Erb's point, and the left for the tricuspid valve area, and the mitral valve. So let's going to auscultate it. Now I will be ausculting the heart from the base down to the apex in a zigzag motion. So this is the aortic valve area, the right second intercostal space, and the next is the pulmonic valve area, the left second intercostal space, and then the Erb's point, the left third intercostal space, and also the tricuspid valve area, the left fourth ICS. So the last one is the mitral valve area, the left fifth intercostal space, here this one. So I can hear that the heart has a love sounds, and if there is abnormalities, then there should be S3 or S4 sounds. And also the for it's easier to memorize, the APETM, the All People Enjoy Time magazine, the aortic valve area, the pulmonic valve area, the Erb's point, and the tricuspid valve area, and the mitral valve area. And now I will be inspecting the jugular venous distension, the JVD. Position the client into a 45 degrees and turning patient's head slightly away from you. So, bring it dito, sir. And then, look for a pulsation in the neck that occurs in several waves with each cardiac cycle. If you see pulsation and are not sure if it's JVD or the carotid pulse, then palpate the radial pulse while watching the neck, and if the single pulsation in the neck coinciding with the radial pulse, you are seeing the carotid pulse. So normally the jugular uh, vein are veins are distended when the head is elevated at 45 degrees. Okay. Um, so I can see that there is the JVD, and I'm going to measure it from the this. On the other side. So the wave of his JVD is an irregular, and um, it has its strength, and the rhythm is normal. So now, and now we will proceed to the physical assessment of the lungs and the thorax. So first is I'm going to inspect his breathing, the pattern of his breathing, if it is the rate of his breathing, if it is his effort, is it swallow, is it rapid, is it even, or it is he looks distressed. And also I'll be palpate his chest and percuss his chest for um, subcutaneous or air tapping, and also the tactile fremitus. So first I'm going to palpate his chest, and also I'm going to do the um, I'm gonna use the palmer of my hand and let the patient say 99 into the costal muscle. So sir, say 99.
99,
As I go butang sa akong kamot, mag-story ako 99.
99, 99, 99, 99, 99, 99, 99.
So the vibration of his words coming through, and it should normally felt and symmetrical from side to side. More important to compare each side. And also, I will be percussing for any tactile primitus. And after percussing, I'm going to auscultate his um, anterior lungs. The diaphragm of the stethoscope, I'm going to auscultate in his lateral position above the clavicle, where the anterior lung filled are. So deep breath in and out. So, sir, as mabutang na ko yung stethoscope mo, inhale ka and then exhale. Okay? Above his clavicle, inhale. Okay? And then okay. Inhale, exhale. The other one. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. So, um, uh, the sounds of his lungs are normal, and when ausculting a female patient, and if the patient has a bigger breast, then let the patient lift his breast tissue, so it's not too awkward for the medical practitioner and the patient. Now we will proceed to his posterior chest. We start in the inspection of his chest, rising symmetrically and falling symmetrically while he is breathing. And also, I'm going to do a percussion of his tactile primitus. I'm going to percuss it. So if they in percussing, you can differentiate it if the lungs is air filled. It is dull in percussing, and it is something. There's a differentiate between when you percuss it, and then now we proceed to the symmetrical lung expansion. I'm going to put my thumb in the 10th rib, match it, expanded 10th rib of the client, and then make like that. And then after that, let the client inhale and exhale. So inhale, sir, and exhale. So as you can see that the expansion of his lungs, it is much expanded together, and as he take deep breath, deep in, equally go up and fall back down together. So the anterior lung filled. I'm going to um, auscultate his posterior chest, and I'll be starting at the anterior lung field also, here, then into lateral lateral pattern. Okay, inhale, sir, and exhale. Tagabutang na ko sa stethoscope. Inhale, exhale. Okay, and then inhale, exhale, inhale, exhale, inhale, exhale. So do not put the stethoscope in the scapula because you can't hear anything. Inhale, exhale. Okay, inhale, exhale. Okay, inhale, exhale. Inhale, exhale. Inhale, exhale. So there are abnormal lung sounds. So the as I can hear the sounds of the sounds of my client's breathing, it is viscular breathing, and the sounds viscular breathing, it is normal. And if there is it is a soft and low pitch sound, and if it is there is abnormalities, maybe there is a wheezing, a rhonchi, a stridor, a crotches, or a pleural fraction rub. So, and now we will proceed to the physical assessment of the abdomen. So in doing the physical assessment of the abdomen, there is a change of sequence. First is I'm going to inspect, and second is to auscultate, and third is to palpate and then percuss. So because if we do the percussing and palpating before the ausculting, it may alter the vowel sounds. So we must do the auscultation and then percussing, and then palpating and then percussing. So first is I'm going to do the inspection of his abdomen, and then his umbilicus. So as I can see, his abdomen is flat, and I don't see any stria, and also I can see that in his umbilicus the color is normal, and the location is normal. It is midway between the epigastric and the xiphoid process, and the color is the same as the surrounding skin color. The abdominal circumference is 56 centimeter as I measured it, and then the skin is unblemished. Okay, and I'm going to auscultate his abdomen into a divided into a 4 quadrant. I'm going to auscultate into 21 vowel sounds per minute into in his upper right quadrant. Okay, I'm going to listen to his upper right quadrant, and then it is borborygmi, of 21 per minute, okay? And then this left upper quadrant, okay? I am carrying, okay? And then the left lower quadrant, and then the right lower quadrant. So after sculpting, I will be palpating his abdomen, so to check if there is any enlargement of his organs, like the liver and the spleen, and also if he has a like test for a like percussing, and also if there is resonance to dull sounds, and then if he has and that's all. Then I will be noting any abnormalities and documenting, and if there is anything that is abnormal, it will be need to have a further evaluation to other healthcare provider. And that's all, and thank you.